know when you've started, Max. Got it. Hello, and welcome to this special panel discussion of the Synopsis Summit. My name is William Crawford. I'll be your moderator today. We're thrilled to have you join us as we delve into an incredibly relevant and timely topic. Is there a place for DID and zero knowledge in healthcare? I want to extend a sincere thank you to our distinguished panelists for sharing their invaluable experience with us today. So let's begin by meeting our panelists. Our first panelist with us today is Dr. David Randall, Ph.D. He's the Executive Director of the American Research and Policy Institute. With extensive experience in healthcare policy, Dr. Randall brings a unique perspective on the policy and regulatory challenges and opportunities in implementing DID and zero knowledge. Next panelist is Pradeep Goel, the CEO of Solve.Care. With over 30 years of experience in blockchain, finance, technology, and healthcare, Pradeep is a visionary leader who aims to redefine healthcare, making it more accessible, more efficient, and with better health outcomes through decentralization. Next, we have Gerard Dache, the founder and executive director of the Government Blockchain Association. Gerard has established over 120 government blockchain chapters globally and is a leading voice on the regulatory aspects of blockchain technology. Finally, we have Dominick Marino, a senior solutions architect at Storj Labs. That's Storj with a J. That's the company. With a unique blend of business strategy and technical leadership, Dominick specializes in decentralized object storage solutions. His ability to translate complex technical concepts into understandable terms adds a multifaceted perspective to our discussion today. So what I'd like to do is, before we dive into our panel discussion, let's quickly demystify two key terms that will come up frequently in the discussion. DID, which stands for Decentralized Identity, and Zero Knowledge Proofs. DID is a new type of identifier that enables verifiable self-sovereign digital identities. Imagine you could own your digital identity like a passport without relying on a central authority like government, Facebook, or Google to confirm your identity. That is what DID aims to achieve. Now, on the other hand, zero knowledge proofs, they are a cryptographic method that allows one party to prove to another party that they know a specific piece of information without revealing the information itself. So think of it as showing that you have the key to a lock without revealing the key's shape. The main difference between the two lies in their application. DID is about identity management, while zero knowledge is about privacy and data security. So let's begin. Given the time that we have, we'll be allotting approximately 4 minutes per question to include follow-up comments by fellow panelists. So our first question will be for all panelists, and then I will have a specific question for each of you, and then one last final question for all of you, as well as your final thoughts. So this first question for all panelists, this is a question about obstacles and opportunities. What are the most significant challenges and opportunities for implementing DID and zero knowledge technology in healthcare? Mr. Goel, Mr. Randall, would you like to begin?
Pradeep, I'll defer to you.
These two technologies, like many others, have clear function and purpose. So DID allows me to prove to you who I am using a token that has been decentralized and issued by a chain or by a community. And that has value in healthcare, clearly, when we talk about streamlining patient-doctor, patient-payer, doctor-payer interactions. A lot of time and money is spent in every industry, certainly in healthcare as well, around proving that both parties are who they are. And typically that's done with the help of some middleman. So for an insurance company to know that the right person is going to the doctor, that person is their policyholder, for the doctor to know the patient they're seeing is who they say they are, and so on. We're used to giving out our license to everybody to prove who we are. In the digital world, this is the equivalent of giving out that license but protecting your identity while proving that you are entitled to receive a service. Then you marry that to zero knowledge, or you look at zero knowledge as a complementary technology, where I can prove to you something without revealing anything. For example, if I want to know that Dr. Randall has a PhD, I should be able to verify that without asking for his PhD transcripts and documents. And that would be the fact that I can get a yes/no answer is zero knowledge, but without having to delve into this, how that knowledge was achieved. So those kind of scenario, those kind of technologies in healthcare go a long ways to helping patient maintain greater control over their identity and over their data. It allows the patient provider to have a more streamlined billing experience, a more streamlined referral and pre-authorization experience. And from a payer perspective, it reduces fraud, waste, and abuse, something that Dr. Randall can speak about at length. So in a nutshell, there are opportunities to use this technology to streamline experience for patient, doctor, and administrator equally. But it will require careful application. Like every other technology, this is not a panacea, but a tool that you can use to make a better operating model and a better experience for the parties.
Excellent. Dr. Randall.
Yeah, so I think what Pradeep stated is perfect, as usual, not to be biased, but the only thing that I would add, which I know firsthand, Pradeep certainly knows this firsthand in terms of his extensive experience, one of the core challenges in terms of implementation is dealing with legacy siloed data systems and how this technology through an episodic mini ledger alternate can be applied within siloed data systems. I would argue, based upon both my experience, and I think Pradeep could speak to this as well, that a blockchain application with specific use cases can work hand in hand with existing legacy systems, especially with public healthcare programs. Government is loath to act fast, and I think that taking an incremental approach in terms of looking at how this could solve the problems that Pradeep has succinctly outlined can go a long way in terms of applying specific use cases utilizing a blockchain.
Great. Gerard, do you have any thoughts?
Sure. Well, I think it's always important to first ask the why question, right? Why is this important? Why are we talking about, right? And the way healthcare data is managed right now is primarily centralized and siloed, like Dr. Randall just mentioned. But the challenge with that is if you have a breach of the data, I think Anthem had a data breach. It affected 78 million patients, right? Optum 360 had a data breach that impacted over 11 million. I mean, I don't know, the tens, hundreds of millions of people that have been impacted by data breaches of healthcare systems, that's a real problem, and something needs to be done about it. Now, prior to the inception of blockchain, we were kind of limited because centralized databases are the way things worked. We didn't really know how to do them differently. So there's an opportunity now with the advent of blockchain and Web3 to actually do something about that problem. So I think that's the first thing that I think we need to hit. This is a big problem. It's important, and we now have the tools and capabilities to address it. And yeah, so I'll just kind of leave it there, and we can cover the other stuff in subsequent questions.
Absolutely. So lots of opportunities, and not without obstacles, though. Dominick.
Very good, thank you. I come at this as a little bit of a different angle as an infrastructure provider supporting these projects in Web3. And I look at the existing healthcare world, let's just clearly define it as Web2, centralized solutions. And we're coming at this as Web3, which includes strong cryptography, distributed systems, decentralized systems, distributed opportunity. And the most significant challenge for me day to day, selling this as a solution architect at Storj, is education. It's talking to the administrators in large health systems. I did over a decade in healthcare IT, and I understand the pace at which those organizations research and purchase. So for me, I come at this at a very different angle. It's educating, getting the proof of concepts in place, getting that feedback loop established, building trust, and ultimately crossing the chasm to wide adoption.
Great, great.
If I
Very,
can
very
add to
interesting.
that, excuse
Go
me,
ahead.
William, if I can add to that, I think education is one issue. The other is specific use case. As a buyer, a former buyer, taking on let's say an insurance company exec trying to look at text that will help me run a better, more efficient operation, I would be loath to buy tech for the sake of promise. I would want to see a implemented use case that I can directly connect to the needs of my stakeholders, be the doctors, the hospitals, the patients, the families, the brokers, in the case of an insurance company, or even the regulator. So if tech speaks to me in the abstract, with using art of possibility, it's very hard to get excited. But if you can come to me and show me a real use case, even if it's a small one, like, look, here is how you can prove the identity of an employee of a group that you're insuring using DID, I'd be much more interested. So education combined with proof is critical.
Absolutely.
Yeah, if I can
Gerard.
tag on to that, if we want, well, let me hit something else and then come back to the use cases. One of the challenges that I think people have in implementing a lot of these solutions is there's really a lack of clear regulatory guidelines and understanding of A, how to do this, and B, if what you're doing is good enough. So a lot of purchasers, and I think Pradeep, let me know if I'm on base here. If they're going to buy systems, they want to know that those systems are certifiable, right? Are they tested? So there's HIPAA requirements. There's all kinds of different types of requirements. And I know in the voting and election systems, a local election official will not want to purchase a solution unless they know that that solution has credibility. It's been certified by the Election Assistance Commission, right? In healthcare, I would imagine it's the same way. So I'm not likely to buy a system or a solution unless I know that it can be audited, assessed, verified to have integrity, because if something goes wrong, I don't want my name I don't want to be on the chopping block for making a poor decision like that. That being said, there are a number of places where they have implemented solutions like that. And I'll use a friend of mine, Dino Cotado Delacio, he's the United Nations. They built a decentralized identity system for the pension, the United Nations Joint Staff Pension Fund. It's a fund of about $80 billion. And they use biometrics in order to essentially verify the integrity of the pensioners. In Canada, there's a known traveler digital identity program. In Latin America, LACChain is working on a variety of things. And so throughout the world, Spain, the UK, Ireland, Germany, a number of those places have different projects. The European Union has something called AIDS, right, which is their program on self-sovereign identity. So around the world, there are pockets of people and organizations that are in the process of either implementing or developing these systems, but it's still very, very early in the space. And the reality is that while there is clear regulatory guidance on centralized identity management system, it just does not yet exist in the decentralized identity space.
Great, great. So my next three questions will be targeted specifically for each one of you. First is Dr. Randall. Dr. Randall, given your extensive experience in healthcare policy, how can policy be shaped to encourage the adoption of DID and zero-knowledge technologies in healthcare? If you can especially touch on fraud, waste, abuse, Medicaid, and Medicare.
Sure thing. Thank you. So to be blunt about implementation, and I think Gerard really nailed it. This must be incremental, and it must be incremental from the perspective that you've got to test it, you've got to have data to support the application before you can scale. Now, there are a whole host of processes and use cases where, in my judgment, that can be fairly easily done. You just have to have willing participants. And again, government doesn't move on a dime. It's slow to change. I can state that from firsthand experience, both serving and my current work. And I'm going to give you a few examples and use cases in terms of how this could be implemented. And again, to a certain extent, it's easier because many of these processes are very fragmented because of siloed data systems, and would lend itself to what I would term pilot or experimental projects where data could be gathered and the use cases substantially verified. First is claims processing, where you could take segments of claims and apply that to a blockchain to reconcile those claims against an episodic mini ledger. Second, that's been in the news for those that follow Medicaid, is enrollment and enrollment verification, and what's going on today, enrollment re-verification. Verifying enrollment and coverage of beneficiaries using an immutable enrollment transaction on a blockchain that could show with proof beneficiary selection and ensure acceptance and proof of eligibility. Many of the siloed data systems, and this is fairly well documented right now, they're having very serious problems in terms of verifying enrollment from the surge that occurred during COVID. And there are many individuals who frankly should not be enrolled in some of these programs that are. Next, that I touched on earlier is fraud, waste, and abuse, where if you deploy a predictive model on a blockchain, you could examine the ledger to specifically detect fraud patterns in real time. That is something that I'm currently working on in terms of deploying predictive models within various provider types and segmenting it that way. Again, from the perspective that many of these systems are both siloed and separate and distinct to a degree. This would, in essence, establish classes of patterns that suggest fraud, waste, and abuse. The final thing that I'll note, again, this is very specific to both Medicare and Medicaid, and that's non-emergency medical transport. Something that most people don't hear about, but it's a vital service in terms of making certain that the population enrolled in these programs, and many times they're vulnerable, get to their appointments on time. Unfortunately, as documented by the GAO and some of my published research, the program is ripe with fraud because it can't be tracked, it can't be verified, and this would lend itself very nicely, in my opinion, to a blockchain application.
Interesting. Interesting.
Can
I
I
knew
tag on
about that
something?
application. Go ahead, Gerard.
Yeah, I want to tag on something that Dr. Randall said, and it's to a degree, it's an issue of scale, right? These identity management, these identity systems have been siloed for such a long time that one of the problems is you can't be everywhere at once. And so I talk to people in this space, and the problem is, okay, if I issue this credential, who's going to accept it, right? And that's why I really appreciate the perspective that Solve.Care has taken in terms of creating care communities, right? You can't do everything at once, but if you can start creating communities that are adopting certain identity management protocols, right, then these communities all interact with each other. And over a period of time, you can deploy that throughout a network. So it's really about deploying these solutions in communities that are networked with other communities. And that's one of the things from the very first time I met Pradeep and I heard about his vision and talking from, when he was in charge of very large organizations, the problem with making big changes all at once, as opposed to taking that incremental approach. I think that's absolutely it's the only way we're going to be able to move forward is by taking an incremental approach and being networked.
Agreed. Absolutely agreed. So speaking of Pradeep and imparting his vision, he has a gift for that. This question is specifically for that. So for Pradeep, how does Solve.Care plan to integrate DID and zero-knowledge technologies into its solutions? Perhaps you can touch on what the overarching goal is, how it affects people's daily lives, real-world challenges, and specific use cases.
So I think the use cases were clearly articulated by Dr. Randall. I'll add a few more because they're all in the same vein. And we can talk about simple ones like medical record sharing. How do I make sure that the records that I'm sharing between two parties, I as a patient sending records to Gerard as my doctor, that the owner of the record is rightful owner and the person I'm sending it to is the rightful recipient. So you could have in this scenario a very simple, elegant solution where there is a token that establishes our roles in a network without revealing our identities. I just need to know that Gerard is a doctor. He needs to know that I am the owner of my records. And those two tokens combine the essential properties of DID and zero knowledge. We don't need to share our identity to share information that can be verified with the benefit of this token combination. And you can almost think of these two technologies as yin and yang of the same question. Who am I and who gets to know who am I, right? The one is absolute proof that I am who I say I am. And the second is who gets to actually see it. So DID versus zero knowledge. Many use cases, when I go see a doctor, how do I prove to them that I have insurance and that insurance is valid? When the doctor sends a referral to a specialist, how does the specialist know that the person arriving at the door is the right person? How does the insurance company make sure that the right person got the care? These are all well-known issues that can be addressed, but medical record sharing is the simplest one. How do we plan to use them? Our model is care networks. Communities that Gerard referred to, we call them care networks. And networks are made up of people who have a role. So in a network, you only publish what your role is. You never publish your identity. So Gerard can join the network as a doctor. You can join that as a pharmacist. And Dominick could join that network as a radiologist. And we would not know who you are, but the network participants could verify your competency, who you are in the network. So in that regard, we can protect every participant's privacy, but allow them to interact with each other with certainty that they're talking to the right people. This is our core framework. And this technology helps implement the framework with greater trust. So you can really count on the fact that the identity tokens or competency tokens, as we call them, are really representing a real competency of the person behind it. And then when we share records or when we exchange appointments or payments or bills or prescriptions or referrals or any other healthcare transaction with each other, they can be done at the role level, or we can reveal identity only to each other and not to anybody else. So it really allows us to implement a new healthcare delivery model where we can run a much more real-time, collaborative, and cost-effective delivery of care, either in a regional or a global or a national or global setting, using telemedicine or remote devices or real-time fulfilling prescriptions using whatever technology you want, drones or home formularies. All these advances that are coming out in healthcare, they all have to tie back to a fabric. And that fabric needs to be trusted by all parties. And that's where DID and zero knowledge essentially become useful, because you can allow everybody on the fabric to be able to trust the fabric and the other side without having to conduct a complete identity or competency check. So that's what we are trying to do.
Great, great. So where the rubber meets the road and the users will interact with these systems to accomplish this will be on the networks that Solve.Care has on its platform.
In the end, nobody buys tech. A care network is a solution. And that solution allows participants to gain direct and immediate value from that network. It's a marketplace. I could join a network where I get better disease management for my chronic condition, or I join a network where I get cheaper prescriptions, or I join a network where I can talk to more qualified physicians across the globe, or I join a network where I can talk to people who are like-minded and have the same disease, and we can collaborate to manage. Or maybe I join a network just to be able to to buy devices cheaper. Whatever the network is offering me, I have to choose to join it. But when I choose to join the network or networks, I need to be able to trust the network. And that's where DID and zero knowledge allows me to engage in that network without revealing my identity or my data unnecessarily. I always like to joke when you get on the phone with some, let's say, bank or credit card company, and they want to know everything about you. They want to know your Social Security last 4 digits and your email and your phone and your address and your zip code and the date of birth. And sometimes I always joke and say, and the name of my dog is Mocha. How much more do you need to know to do a simple thing for me? And they're doing this not with ill intent, but because they need all that information to establish one Boolean question. Is Pradeep Pradeep? That's it. They just need to know that I'm not impersonating William. In that scenario, we reveal so much of our identity to them, and they have to verify that against a big database, which if that gets hacked, we end up in trouble, and we see that news every single day. This database hacked, that database hacked. What if you could actually answer that question with a single question? What's your token ID? And you enter that token ID into your system, and that through a series of contracts, smart contracts as they are referred to, establish the identity. They won't need to know all my information about date, age, gender, zip code, spouse's name, mother's name, children's names. All this is information to achieve one single fact. Is Pradeep who he is? And what if I could just give them a token ID? And that token ID would verify everything they need to know. And that is the kind of example where we can restore some sense and order to this highly centralized Web 2 world, as Dominick clearly stated at the beginning. Because right now we have to render so much of our identity to a service provider to get the service. We trade off our privacy and data security for service. We shouldn't have to do that. And that's the core premise that I think DID and zero knowledge solve. And that's what we're trying to implement in the care networks as a core functionality. Anybody can talk to anybody once they've established each other's tokens correctly.
William, if I could tag on to something that Pradeep just said, and also give a shout out to Storj. Pradeep, I'm going to respectfully disagree with you on one item, and that is that you said that the only reason they're capturing all that data is to identify who you are. And I think that in the current economy, data is the new currency, right? These companies capitalize by collecting these huge amounts of data, selling them to data marts that essentially resell them to retailers and advertisers. There is a huge amount of financial benefit that comes to these companies from collecting all your data. And they say that they're doing it because they need it. Reality is they're exploiting it, right? And again, not that that's bad. Look, it's a legitimate business. They're collecting data, they're selling it. That's the free market. I don't have a problem with that. But I think that individuals ought to be able to take control over that. And I think Pradeep and I would agree on the same end. The other thing that I really want to do a shout out to Storj and Dominick, because what Pradeep is doing with Solve.Care, right? Companies like Storj are doing the same things with a lot of the data and the information, right? If we have all of our records in one central place, then that central place can control access to that, right? And we need distributed, decentralized solutions for all the documents, the data, all that sort of stuff as well. So I think that those two types of companies go hand in hand. And Dominick, I'm not that aware of your company in particular, but I am aware we've had at our last conference, we had a couple decentralized data storage companies present and sponsor. And it really hit me the importance of your industry. And so shout out to you and you guys and what you're doing. And we just hope that you carry on.
Great, great. So my next question for you, Gerard, from a governmental perspective, what are the regulatory hurdles for adopting DID and zero knowledge in healthcare? And if you could also touch on identity management as well.
Well, I think it's not necessary that there are regulatory hurdles as much as there's an absence, right? Now, typically when the government is thinking about identity, the first place it goes to is banking and finance, right? So, and one of the areas where the governments are really, really, I don't want to say afraid of, but they're really putting a lot of regulatory challenges is in the area of decentralized finance, right? So right now, if you want to build a decentralized system, what I'm hearing most people say is do it anywhere but in the US. Because the minute you take a token, especially if that token has any value to it, it's going to be slapped as a security. And then you've got all kinds of legal and regulatory, potentially large fines. So a lot of folks are exiting the US because of that. The European Union, I think, is moving forward, and other countries outside the United States are moving forward in a way that's much better. There are associations and organizations, Evernym is one, the World Wide Web Consortium, right, which is the W3C. They're working on standards. So there are organizations around the world that are working on standards. We are working with the United Nations on something called the Blockchain Maturity Model, and has several supplements associated with it. One of them is the Identity Management Supplement. So there are a number of organizations that are moving this forward. Unfortunately, it's really not the US from what I've seen, from the vantage point that I have.
Great. Anybody else have any comments on that? Okay.
I think this is a very big topic, but in a nutshell, what I would like to add to what Gerard said and go back to the previous comment, you're absolutely right. Companies do monetize data and single-handedly benefit from it, and do not seek appropriate consent and do not share in that monetary reward. And that is something that overall Web3 and blockchain is seeking to restore that balance back to the data owner, not the data collector and the custodian. And in healthcare, that's particularly relevant, although the law protects the patient quite strongly. The monetization of data is an even bigger incentive in healthcare, because you can run trials and you can conduct research and you can target people with certain disease conditions to market products and services to them that they are much more likely to buy. So healthcare is a very rich and also a very sensitive field for data mining, but it is certainly happening. And we won't be able to stop it, and nor should we, because data mining of healthcare is good for humanity if we can bring out a drug faster or cure cancer. But what is wrong about the model is the inequity, where somebody benefits from your data without your knowledge, without your consent, and or without sharing the monetization of your data as a reward. And I think that is something that we can absolutely address with the Web3, where data is not handed over to a single entity, where entities and innovators like Storj can come in, but there's also then the consent and identity establishment. And many people would not like to sell their data with their identity attached to it. So zero knowledge and DID comes back to letting me share my data and receive the appropriate reward for it, should there be such a mechanism available, without having to sacrifice my privacy. Because many people will not sell their data if it comes with the identity attached to it. So those kind of issues, as we look down the road, are addressed with the new up-and-coming technology.
Very well.
Does anybody remember the name of the woman? I think her cells were used as stem cells for the whole medical industry. She was a poor think she was the daughter of a slave or something like that. And then her cells have been used across the medical community for years, and she never received any. Henrietta Lacks is the name. So if you haven't heard that story, that's a yeah.
The book is the
There's
there's
a book called The Life of Henrietta Lacks. But anyway,
The Immortal Henrietta Lacks.
The Immortal Henrietta Lacks. So it's a great use case on the importance of healthcare data.
Absolutely.
Yes.
She-
Yes.
So my next question is for Dominick, and then we'll do one last question for all the panelists and final thoughts. For Dominick, how do decentralized storage solutions, such as your company Storj, complement DID and zero-knowledge technologies in healthcare? And possibly you could touch on successful examples of the technology application that makes the industry better, and maybe industry parallels.
I'd love to. I always start with an orienting statement. So when you do work in IT, what are you doing? You're doing compute, you're doing network, you're doing storage. Computers where you run your software. Network is how you get data between systems, to consumers, to physicians. And storage, well, that's where it should live and not to go away. So from a security perspective, what are we focused on? Well, we're focused on upholding the CIA triangle for data storage, which is ensuring the confidentiality, ensuring the availability, and ensuring the integrity of the data. Where we've done it different is we've built a distributed system. Now that system's over tens of thousands of points of presence. So confidently, your data is nowhere and it is everywhere. And it gives you full control of it. Now, without delving into the tech, which would be a whole webinar in its own, we give the consumer the ability to hierarchically derive access to their data. Meaning, William, you can see a provider and you can grant them, because let's say you programmatically or you have a smart contract, you can grant them access to the relevant data they need to render you care. So Storj is an infrastructure provider in the Web3 space, built with Web3 ethos, a focus on distributed and decentralized systems that provide superior performance, reliability, and availability of data. I'll add an example here from cardiology. So I spent about a decade in cardiology, and I spent about a half a decade in healthcare analytics. So I have specialty care experience in IT and across acute and specialty care on the analytics side. The biggest issue we had there was interoperability of data, because you, the consumer, you, the patient, were not in charge of the data. If you wanted a copy of your medical records, you walked to the department and they burnt you a CD that you could then bring to your next provider. Who has a CD? Like, there's no CD in my, they still do that. Is that safe? Is that data encrypted? Is it going to sit in your car on the dashboard? So we have provided a solution that puts the control and the immutability, right, the record keeping in the hands of the consumer or the trusted organizations like Solve.Care, implementing not in a Web2 centralized world, but in a decentralized or distributed Web3 world.
Absolutely. Great point. I mean, that hit home. As a veteran, I was giving a CD-ROM of all my medical records, and it got scratched, and they said there will be no more. All gone. So perfect solution. So let's see the last question for all the panelists. How do you see the future of this technology evolving over the next 5 years? I'll start with you, Pradeep.
Well, it's always hard to predict, because sometimes we are overly optimistic. Sometimes market moves faster than we expected. I think I can't say 5 years, but I can say what the next evolution is. So first, I would go back to what Gerard said. We need communities, a series of communities that are adopting and using and certifying and acting as verification sources of these DID tokens and zero knowledge proof of whatever you're trying to prove. So for example, in a very simple sense, if I want to issue a token proving that a certain individual is an endocrinologist, the best person to verify that endocrinologist token is other endocrinologists. So it would make sense to build a community where specialty care providers are able to get and receive and help verify other identities and competencies. So we as patient can rely upon that community and that chain underneath to say, well, a token issued on that chain is really based on facts having been checked by competent authority. But that authority is not a government or a hospital, but rather a community of endocrinologists. So those kind of community frameworks are needed for specialty care, for other types of tokens. So that needs to happen and will happen. How fast that happens depends upon how easy we make the process, what incentives we offer as an industry, and whether this is, that's one side, the supply side problem. The other side of the problem is demand side problem. We can have this great competency chain where everybody's tokens have been verified by others, but who's using that token to deliver better care? So that side is the issue of demand. Can we create demand for better use cases, better delivery model? And that's where Solve.Care in particular is trying to build care networks which consume tokens like the one I mentioned. So supply side is community-oriented function, demand side is use case-driven function, and they need to come together. And then underneath all of that is, why should I care? Who is benefiting from it? So that we can take a B2B approach and drive value to the enterprise. We can take a B2C approach where you drive value to the patient. And the answer is yes. You got to do both. You have to pull business to this innovation. We also got to deliver tangible value to the patient immediately. And again, that goes to a clear strategy that we feel, but it's not easy to do, that we've been on this path, and so are others. By no means are we unique. So where I see the evolution happening is on the supply side, creating communities, on the demand side, creating very tangible value proposition for consumer and business, and those converging, those curves have to intersect for that viral adoption. So that's the way, this is going to be the path forward. And sometimes one leg will run faster than the other, but you're going to see these continuously come back and balance each other out till we see a new model. The last thing I'll say is that I think in the next 5 years, I hope and I expect that we will stop talking about tech and blockchain and Web3, and we will be very much focused on what's in your hand as a consumer that you can tap and use. The Amazon buying experience in your hand, or Google search experience in your hand, or the Apple apps experience in your hand is what drives adoption. That underlying tech, nobody cares. Very few people care about the fact that the screen on your iPhone is an engineering marvel, right? It's touch sensitive. It's got so much technology built into a single sheet of plastic that 20 years ago would be deemed as impossible. And we could wax poetic about how amazing the technology behind the iPhone touch screen is. People actually only care about the fact that they can touch and use the phone. And I think that's really where we need to move to. We need to move as an industry away from talking about the tech and its potential to concrete and grandma-friendly use cases, and then we'll see adoption. So I'm hoping I can't predict that'll happen, but I fully am working along with people like yourself and all of you to make that tech viral. And that's would be my hope and expectation for the next 5 years.
Right. Well, we can agree on one thing: the future is always exciting, but we rarely get it right when we try to predict. So, Dr. Randall, your vision for the next 5 years.
So I think what's going to drive adoption of the solutions and use cases that have been discussed here are the problems that they're going to get so bad, and we're quickly approaching that in a variety of systems, both public and private, that the implementors or custodians of those systems are going to say, what else is out there? How can I solve these nagging problems that I have? If we tick down the use cases we've discussed there, they are ripe for something that's different, that will be more efficient, more user than we're dealing today. So that process judgment will be incremental, and they will be driven by the problem.
There you have it. Gerard, how about you? Your vision for the next 5 years?
Well, I would say we're kind of at a crossroads, right? And it could go one of two ways. I think that there's a group of people that really believe in decentralization and the autonomy of the individual. And then there's another group of people and organizations that really wanted to centralize control, right? And so I can't predict which way we're going to go. I do know that if the decentralization folks don't continue to work and come up with innovative solutions, that will go the other way, right? And I don't want to live in a world where there's massive centralized control, right? Lord Acton, I think, said power corrupts, and absolute power corrupts absolutely, right? And so that's a world that I want to live in. Now, how do we get there? I think standards are incredibly important. I think standards are, for us to be able to get something that is globally adopted, we need standards, which is why we're doing so much work in the standard space. But to tell you the truth, I think we need to look at standards in a whole new way. The way we looked at standards before is we would nominate people from countries all over the world. They would get together in a room. They would decide what the standards were. The smoke would come up after the rollout. Here is ISO whatever, right? And then everybody would have to comply with those standards. But if you look at how Bitcoin, happened, there was no Bitcoin committee. There were some guys that came up with a protocol. They started using it. Other people thought it was kind of cool. They started adopting it, and then here we are years later. There's thousands, millions, I don't know, maybe billions of people around the world that are using that protocol. It wasn't because governments or central authorities defined the standards. It was because technologists came up with solutions that worked, and people adopted it, and it became a standard. And that's why when you go to log on, we developed these single sign-ons with Google and Facebook, right? They came up with a solution that everyone adopted. So the two truths that I think come out of that is, number one, we're going to go either centralized or decentralized, and number two, it's the innovators that are going to set the standards, not centralized governing authorities. That's my two. Oh, and incidentally, I'd like to invite all of you guys to participate in our blockchain and infrastructure conference we're going to do in May of 2024. Healthcare, decentralized storage, all this stuff are key. I'm sorry, future of blockchain and infrastructure in September of 2024. Want to see you guys there.
I think that's, if I may just add to that, I think standards, a point that Gerard makes, is very important, and so is certification. And I think for enterprise to adopt it and for consumers to trust us, we do need more than cryptography-based trust. We also need competency-based trust, and that will come from having things like whether GBA is building the blockchain maturity model. These are things that we need, even though they may seem antithetical to the idea of total decentralization. The migration from fully centralized to fully decentralized is a long road. And it's even questionable whether we need to be fully decentralized to be a fair world. We know that the fully centralized world is not fair, but we also cannot say that pure and full decentralization is the only definition of fair. Somewhere in between lies the equilibrium that society can accept. And we need to find that balance quickly, or else we will go back to a more regressive and oppressive model than we have even experienced in the past. Because as the stakes grow and as the monetization and the incentives grow, there's going to be a tendency to go even more centralized, which is what Gerard is saying. But to get to the middle, where patient and consumer and citizen and individual has rights that are not revocable at the whim and fancy and the financial needs of a corporation or a government, we don't need complete decentralization. So having good standards, good certification bodies, communities that are trusted rather than just the tech, that's where I think the happy medium is. And from there, maybe we will, over time, generationally, able to move to a fully decentralized world.
Yeah, Pradeep, if I could tag on that. So as many of you know, we do have a certification program called the Blockchain Maturity Model. And I can't tell you how many organizations have come to us and they said, hey, I think we're level 5. We have these PhDs and we have this high tech, and we would ask them basic questions like, can you identify your critical components, and does somebody have responsibility to monitor their operational status? And they look at us like deer in the headlights, right? Or we say, have you defined basic roles and responsibilities, right? We ask them simple questions about continuity of operation. And they say, you know what, we don't really want to do that thing right now. And it's amazing how many organizations think they're level 5. And when we ask them simple basic questions, they're not even level 1. So we're actually developing a directory of trusted blockchain solutions. We're putting the report together to be delivered to the Secretary General of the United Nations. And we are going to be posting a directory of solutions that can be independently and objectively evaluated, essentially by experts, to be trusted and separate the wheat from the chaff, because there's so much, unfortunately, there's so much garbage. And Pradeep, to your point, our goal ultimately is for this entire certification system to become a DAO. So like you said, it's a long road, but we don't want a single person making these decisions. We do want it to be distributed so people earn credibility in terms of their ability to assess, and the validity of their assessment is based on the community's acceptance of their credentials. So that's all part of our roadmap. And we're working closely with the United Nations to develop a global mechanism by which people can trust blockchain solutions.
Excellent. That's exactly the type of thing we need.
So on the technical front, Dominick, your vision for the next 5 years.
Let's transition. So following up with Pradeep, minimum viable centralization. The reason a lot of projects in Web3 don't actually accomplish anything beyond talking about really neat ideas for the next 5 years is because they let perfect be the enemy of good enough. Shippable intermediaries, right? Get work done, establish credibility, move forward, build better. Minimum viable centralization. In the next 1, 2, 3, 5 years, you'll see infrastructure options become available in the Web3 space that actually can meet your needs and that are actually better solutions. I implore you today to look at Web3 infrastructure providers. Compute, for instance, it's very challenging. And you'll see over the next few years that visionaries like Pradeep will be able to run their Web3 projects on Web3 infrastructure. The truth is that almost all Web3 projects today run on Amazon, which is a Web2 centralized provider. I always go, what's the point? Over the next 5 years, you will find that you increasingly have options to use more performant, more secure solutions because they are designed from the ground up with Web3 ethos. It is perfect for storage. Since the beginning of time, we have known that if you have one hard drive and it fails, your data goes away. So when you want more speed or more resiliency, you put a bunch of hard drives together, right? In Iraq, your IT team keeps those 20 hard drives, those now 200 hard drives, healthy and happy. We just did it across 22,000 drives. You'll see compute providers, network providers, security providers all doing this over the next few years. We feel we're mature at this point. Storj with a J is ready for prime time, and we're doing a lot of great work today. And you'll see others in the distributed or decentralized infrastructure space mature substantially over the next half a decade.
Agree, 100% with Dominick. I think the statement about most of the Web3 projects being ultimately running on Amazon sums up the current state of affairs, and the migration to a decentralized infrastructure is both necessary and therefore inevitable.
Dominick, in order to achieve level 1 in the blockchain maturity model, that's the very first thing. That's the very first question we ask. It's part of the analysis we call distribution. And if the Web2 if the project is as you described, they can't get past level 1. So we should talk, because literally everyone that comes to us that wants an assessment, we're driving them to, they got to go to decentralized storage. So we should definitely talk.
It's yes. I'd love to work with you on it. It's amazing what we've accomplished The project's fully open source. You know, we're really dedicated to the ethos of Web3, but we won't let minimum viable centralization stop us from securely storing your data. A bit of a plug for Storj on the end of this. Storj is #1 on the Web3 index. Why? We store the most data, like actually store the most data, and we deliver the most data back to the customers with the highest performance of anyone in this industry. We're faster in any region around the globe than Amazon's S3 service because we're not fighting fair. We're not playing fair. We can buy hard drives because of latent capacity at significantly less than the hard drive manufacturers sell it. Those drives are already spin powered and cooled. We clean up waste. We create a great system. We've got a great ESG story. You know, it's very green because there's all this wasted space that we're putting to work. There's all these other things that we didn't address today in decentralized infrastructure that make the world a better place for, well, beyond the impacts directly to health.
Great. So to wrap it up, I'd like to get everybody's final thoughts. But before that, just kind of the takeaways that I've heard from this fascinating conversation. We have challenges, we have opportunities. We need to take an incremental approach. Also, there's healthcare data ownership issues, interoperability. It has to be easy to use, grandma friendly. That's a prime directive for the industry, and infrastructure of trust and standards and verifications. And I also learned a new word, minimal viable centralization. So I'd like to have everybody's final thoughts before we wrap up.
Well, the final thoughts from my side is that we are really at a crossroad, like Gerard said, but I'm very optimistic that the value that this new technology stack and a new way of thinking about what is our role in society, what is our role as consumers, and how our data should be consumed by others, I think represents a more equitable future. And it is our responsibility as technologists and as leaders to see that vision realized. And by no means I mean to say it's easy or that it'll be, it'll be a smooth ride, but the payoff to humanity is enormous. And there is an economic payoff for those who make it work. But this is something we have to do. And many of us could be doing other things in our life and probably taking on easier challenges and making a lot more money doing much easier things. But this is important, very important. And it goes beyond technology adoption. It goes to fairness and equity in the world. So me and my team are all in because we believe this is worth investing your time and your life into.
Anybody else? Next.
I just have a couple of points. Number one, Dr. Randall, I'm so glad and grateful that you're doing the policy work that you're doing. Keep up the good work.
Thank you.
William, you are a great moderator, just a great panel. And Dominick and Pradeep, let me know when you want us to go ahead and schedule your assessments. I'll let the team know.
Thank you, Gerard. We will.
Dr. Randall, final thoughts?
Yeah, so I think we know where the problems are, where the pain points are at. I am very confident that the solutions that we've discussed today, that I've written about, that Pradeep is doing as we speak, they will eventually come to fruition to solve these problems. But again, given both the nature of government and the incremental in nature.
Absolutely. Absolutely. Dominick?
It's been a pleasure. We'll keep plugging away at it. I can't wait to support Pradeep. And I look forward to that vision of the next 5 years.
Thank you, Dominick. Likewise.
I want to thank each and every one of you. This has been fascinating, very informative for me, hopefully also for the audience. I want to thank the viewers for clicking in and watching. And I look forward to working with all of you as well. So thank you so much. You guys have a great day.
Thank you, William. Well done. Thanks, everyone.
Thank you.